Dozens of South Carolina children were removed from their homes in 2014 after being exposed to dangerous drugs.
WYFF News 4 Investigates found there's no guarantee that these children will get the long-term medical care they may need.
And here in the upstate, people are working to change that. We do need to warn you, you may find the images you're about to see disturbing.
Greenville County deputies shot this video in June of 2014 inside a home that is not only filthy, it's so dangerous deputies had to wear hazmat suits as they point out substances like bleach. They say it was used to make meth. This video shows the conditions children living here were exposed to. Human waste on a mattress, roaches on the floor near the refrigerator. There are 2 baby bottles inside a kitchen cabinet. The sheriff's office says Michael and Monica Luker were slapped with multiple charges, including manufacturing methamphetamine in the presence of a child. Deputies say 4 children, ages 1, 7, 11, and 13, were removed from this Greenville County home. WYFF News 4 Investigates found statewide 88 children were removed from homes with meth labs last year.
A lot of times we get them with the clothes on their back that are so filthy you throw them away.
Foster parents like Courtney care for these children. Right now, she has 2 babies in her home, but Courtney cannot give details about why they are in her care.
They are treated as our own children.
She says many of her foster children were born addicted to illegal drugs.
Wow. What are they like? 24-hour crying. We've had one that was so bad, the ER doctor said a day or 2 more in his home he would have passed.
The Department of Social Services tells WYFF News 4 Investigates that all children receive a medical assessment before going into foster care. But we learned it's often up to the foster parents to make sure children receive the additional medical care they might need. DSS said the agency's records don't specify the type of drugs children have been exposed to, and DSS could not tell us how many children are receiving follow-up medical treatment due to drug lab exposure.
Kids can fall through the cracks, easily can fall through the cracks. They don't get the services to follow up.
Michelle Greco is a children's advocate. She says there are so many agencies involved in drug cases, but the state doesn't have one central database everyone can access.
Not everybody networks or connects to know what the other person's doing.
A WYFF News 4 Investigates analysis of DSS data found out of the more than 1,000 children who entered foster care in the upstate last year, about 1 out of every 4 had drug abuse by a parent listed as one of the reasons.
These children depend on us. You know, they have no voice. If they're real young, they don't know what to expect. And we have to advocate for them to make sure that they are getting what they need.
The Greenville Health System is one of the local agencies leading the charge to work with DSS to launch a statewide database to keep track of these children.
To make sure that it's a coordinated response, that information is shared.
Courtney believes a statewide database would help foster parents do their jobs.
You're bad asleep.
And help keep the children they care for healthy.
There will be training exercises and conferences to help create this statewide database. Many will be right here in the upstate. We will, of course, keep you posted on the progress.